I'm Dr. Suelyn Hall, founder and owner of Quantum Health and Wellness Center. I'd like to talk to you today about the importance of balancing and optimizing hormone levels for overall health and well-being. 50 million women reach menopause and 60 million men reach andropause in the next decade. And most of these patients are being treated with antidepressants, anti-anxiety, sleeping pills, cholesterol medicines, blood pressure medicines, and NSAIDs. Most of these patients have hormone deficiencies and would benefit from evaluation and treatment, whether it's thyroid, cortisol, estrogen, testosterone, or progesterone that's off. Testing to determine what is abnormal is essential. Ever since the Women Health Initiative study, a lot of women have gone off hormones, and many of them are suffering from heart disease, cardiac issues, and many times need replacement of hormones. 350,000 women die from heart disease per year, and 28,000 women die from breast cancer. The Women Health Initiative study was the cause why a lot of women concerned about breast cancer discontinued their hormone therapy. Their heart disease is much more prevalent, and they would do better with replacing hormones. And as we know, hormones are helpful in preventing heart disease by helping to reduce plaques in our coronary arteries and help to prevent platelet stickiness. Now, as you know, hormones are in every cell in the body. They're in the pituitary gland, the adrenals, ovaries, and testes, and they're responsible for changes in our bodies. They're important for our circulatory system, the way the body gets rid of toxins. We're exposed to so many toxins, so releasing toxins by either exercise, massage, yoga therapy, float therapy, as well as meditation are methods of releasing toxins. Hormones are responsible for every function in every cell in the body. They are responsible for how we look, feel, think, and perform daily. Now, what bioidentical hormones are, you get the base model from plants such as yam and soy, and they add the necessary carbon, hydrogen, and oxygen to look exactly like what our body makes, such as testosterone, progesterone, estrogen, cortisol, and thyroid. A lot of people are deficient in some of these, and replacement is necessary. Synthetic hormones is what's made by the drug companies. Drug companies can't patent what occurs naturally in nature. So in order to patent and sell a product, they have to create it in the lab synthetically, and those are the ones that have increased risk for cancer as the body doesn't recognize that compound. It's unnatural. Suzanne Somers made bioidentical hormones popular by selling several books. Her new book, Toxic, is actually one of the ones that has educated people that there are other options for patients who want to have hormone replacement and do not want to do synthetic compounds. The Women Health Initiative study compared synthetic hormones. They compared Premarin, Provera, and Prempro, which are all synthetic, and these had an increased risk for cardiovascular disease, strokes, and DVTs. They did not include bioidentical hormones nor use transdermal formulas. The KEEP study was done where Premarin was used at a lower dose, and it showed even at a lower dose, it improved HDL, decreased LDL, and actually improved insulin sensitivity by lowering insulin resistance. So we know that estrogen, even a synthetic estrogen, is known to reduce heart disease by increasing insulin sensitivity, lowering insulin resistance, increasing HDL, and decreasing LDL. It also slows the progression of atherosclerosis, and it actually lowers coronary artery calcium accumulation. Secondarily, improves hot flashes, night sweats, mood swings, sexual function, and bone density by replacing hormones. There's no difference in breast or endometrial cancers, heart attacks, strokes, or thromboembolic events, even with giving a lower dose of synthetic hormones, such as estrogen. Now, the most recent study is the Danish study. That was a 10-year study, including 16,000 women from 2003 to 2013 that received bioidentical hormones, and it showed there was a reduced risk of mortality, heart failure, heart attacks, cancer, thromboembolic events, and stroke. And after 10 years, there was no adverse events. Recent articles in JAMA, OBGYN, clinical geriatric medicine, as well as breast cancer research show that synthetic progestins has an anti-apoptotic effect and actually increases estrogen-stimulated breast cell mitotic activity and proliferation, where bioidentical hormones actually downregulated estrogen receptors in the breast and induced breast cancer apoptosis by diminishing breast cell mitotic activity and arrests human breast cancer cells in the G1 phase by upregulating cyclin-dependent kinase inhibitors and downregulating cyclin D1. So what all of that means is bioidentical hormones, such as progesterone, actually helps to reduce the risk of breast cancer. Now, as we know, all hormones in our body diminish with age. Estrogen, testosterone, progesterone. The only hormone that increases with age is cortisol. That increases in a stress response. Our body secretes cortisol in a fight or flight response, in a way to protect the body. However, under constant stress, when our cortisol continues to increase, this actually is a negative effect on our body long term. So what the body does in a negative feedback mechanism is when estrogen and testosterone decrease with age, cholesterol naturally increases with age. But our body tries to make more cholesterol. As it's trying to make more cholesterol, it actually produces more cortisol when we're stressed. So reducing stress is a huge part in managing patients' health. And so the best ways to reduce stress are exercise, nutrition, weight loss, because that reduces stress on your body actually, and then yoga, float therapy, as well as massage and meditation. As we age, all hormones decrease. Testosterone actually declines in our 30s. That's why a lot of women in our 30s that have decreased sexual desire, decreased energy, they often blame their tiredness, their decreased libido, their energy on being busy at work or with the kids. Most of the time, it's really a testosterone deficiency. Symptoms of early menopause include fatigue, weight gain, night sweats, mood swings, sleep disturbances including difficulty falling asleep as well as staying asleep, decreased libido and sexual desire, and vaginal dryness. Now, a lot of people in their early menopause or intermediate menopause have vaginal dryness. A lot of patients that I see have incontinence, infections, and actually present with urinary symptoms, and many times it's a hormonal problem. Cardiovascular disease, Alzheimer's, cognitive disturbances, osteoporosis, skin changes, eye and tooth degeneration, all of which develop when our hormones are deficient. Now, estrogen dominance often presents with anxiety, panic attacks, fibroids, ovarian cysts, endometriosis, infertility, miscarriages, migraines, decreased libido, and fibrocystic breast disease. Many times, adjusting with progesterone helps to reduce estrogen dominance. Estrogen deficiency, which is where I see a lot of patients in my urology practice, patients present with incontinence from coughing, sneezing. They also present with urge incontinence. Many times they have difficulty sleeping, falling asleep, staying asleep, difficulty with vaginal dryness and soreness, painful intercourse, tearfulness, palpitations, and most of these patients are estrogen deficient. Replacing estrogen markedly improves these symptoms. And as we know, estrogen decreases overall mortality, cardiovascular disease, osteoporosis, fractures, urogenital atrophy, and dementia. When administering and replacing estrogen, we can do this in many different ways, different routes of administration, including creams, as well as pellets or troches. Estrogen is not good to be swallowed, and so different routes of administration such as creams or pellets are better options. Progesterone. Progesterone is also a very important hormone for mood, irritability. Giving progesterone when estrogen is also needed is important balance, because all of our hormones need to be in synchrony, and balance with progesterone, estrogen, and testosterone is important for a feeling of well-being. Now, we've given men testosterone for years, haven't really done that for women, and testosterone is so important for building bone and strengthening bone. As estrogen is responsible for maintaining bone, progesterone is responsible for building bone, and testosterone is responsible for strengthening bone. The laboratory values that we check in our office include the 3 levels of estrogen: estriol, estradiol, and estrone, DHEA, testosterone, free and total, thyroid. Most patients that have a low basal metabolic rate, less than 97 temperature in the morning when they wake up, usually have a thyroid deficiency, even if their numbers are normal. We also check TSH, T3, T4, reverse T3, as well as lipids and CBC. When we replace testosterone, you want to make sure that hemoglobin hematocrit levels are normalized. Sometimes they may cause erythrocytosis when testosterone is given in excess. So checking for risk factors in both men and women is essential in managing patients with hormone therapy. We've given men testosterone for years. Now men have been focused on sexual function. Most men come to me for decreased libido and ED. They never present with saying that my wife thinks I'm cantankerous, or I'm depressed, or I have poor concentrating ability, or I have memory issues or sleep disturbances. They only come for sexual function. Now, inadvertently, by treating their sexual function or sexual dysfunction, the other things improve, such as fatigue, weight gain, sleeping difficulties, memory issues, poor concentrating ability, as well as frailty. So when we replace testosterone, there are many different routes of administration, including intramuscular injections, transdermal formulas, patches, creams, injectables, including pellets that are placed under the skin. Some patients also require human chorionic gonadotropin, which is HCG, to help boost their testosterone as well. We always check testosterone in the morning between 7 and 10 a.m. because of the diurnal spikes with testosterone. And all forms of testosterone have actually been bioidentical, including testosterone cypionate and enanthate. These are the more popular testosterone replacement in the form of either injection therapy or pellets. Testosterone actually helps to improve hip to waist ratio. It also helps bone density, but these things take quite some time. Most times it takes at least a year to 3 years to seeing a significant difference. Now in regard to erectile function, that improves actually a little bit quicker. Morning erections improve within 6 weeks, but to get full erection usually takes at least a year of testosterone replacement. And in men, we always make sure that they have a PSA checked, because the last thing we'd want to do is to give a male who has prostate cancer testosterone, even though it's not proven that testosterone actually causes prostate cancer. But if you do have prostate cancer, you want to make sure it's cured before testosterone is replaced. The labs that we check for males are PSA, DHT, testosterone, estradiol, hemoglobin A1C, CBC, and lipids. A lot of time when we replace testosterone, either free or total testosterone may not increase if it's converting to DHT or estradiol. So we need to check these levels in patients to verify that it's not that they're not absorbing or tolerating the testosterone well, but they may be converting it to estradiol or to DHT. We also check thyroid in men, since thyroid symptoms may be similar to the symptoms that men have with low testosterone, including decreased libido, decreased energy, and fatigue. Now, if patients are at increased risk for coronary artery disease, you want to make sure you do a stress test, check coronary artery calcium, as men can have increased risk for heart disease as well. By giving testosterone, it doesn't cause heart disease, but if they do have a risk of heart disease, you do not want to give testosterone. And being enrolled in a master's program and obtaining my fellowship in metabolic medicine has given me the tools to be able to treat the patient safely and effectively.